Gromko, and this is Transgender Medicine Made Simple. Today we're looking at a question of the week, and that question is, should a transgender woman take testosterone? Well, the answer is sometimes yes. Let's take a look at this question in 3 simple points. Point number 1, males and females, whether they are cis or trans, all produce estrogen and testosterone. You know, some people believe that females produce estrogen only and males produce testosterone only, but that just isn't the case. Certainly, cis and transgender females produce more estrogen and significantly less testosterone than cis or trans males, but everybody produces both estrogen and testosterone. Let's take a look at the normal levels of testosterone in cis females. So first of all, let's start with estrogen, or estradiol, which is the dominant form of estrogen in cis and trans females. That level can range anywhere from 19 to 357 picograms per milliliter, according to LabCorp. Now, the very high levels occur right at the peak before ovulation or the release of an egg. Most of the time, these levels are somewhere between 100 and 200 picograms per milliliter. As far as testosterone goes, in premenopausal cis females, testosterone levels range from 10 to 55 nanograms per deciliter, so it certainly isn't zero. Point number 2, cis or trans females may have symptoms if their testosterone is very low, and these symptoms might include sexual dysfunction and low libido, fatigue, low energy, loss of physical stamina, or musculoskeletal changes like muscle weakness, or even accelerated bone loss. There can be cognitive and mood changes reported, like brain fog, mood disturbances like mild depression, anxiety, or just a lack of pleasure. Point number 3, trans women may be reluctant to take testosterone. And why not? My goodness, we've been using medications to suppress testosterone probably for several years in most trans women. And so all of a sudden recommending testosterone can feel really quite foreign. So how can this be addressed? Nobody is ever required to take testosterone, but here are some things that I have found to be helpful if a trans woman is having symptoms of low testosterone and would like to try it. In my practice, I start testosterone with very, very low doses. So I might, for example, take the dose that I would initiate a trans male in, like maybe 25 milligrams, and cut that down rather than every day to every 3rd day or every week. I often will use a shorter acting testosterone like gel that can be washed off rather than injectable testosterone. I monitor blood levels and stay within a usual range, which would in this case be the cis female range. And I back off right away if there are undesired changes like facial hair or acne. Now, this is all very important information, and I hope that it's been helpful for you today. If so, please like this video and do subscribe to my channel, Transgender Medicine Made Simple. Now, do you have a question that you'd like to have discussed in a question of the week? Please submit it in the comment section below. Thanks for watching, and I'll see you in the next video.